The smell of a trauma bay doesn't leave you. Not really. It soaks into the fibers of your scrubs, settles into the back of your throat, becomes a permanent resident somewhere behind your sinuses. Antiseptic over copper. Bleach over fear. Cave used to say the smell was the honest part of medicine. Everything else, the paperwork, the hierarchies, the laminated protocol sheets taped to every flat surface, was performance. The smell was the truth. Cave had been dead for 3 years. Nadia Roussel had been a civilian for 2. She parked her 10-year-old Civic in the staff lot of Riverview General at 06:42, 18 minutes before the start of her day shift, and sat for a moment with the engine ticking down in the February cold. Outside, the sky above Hamilton was the particular flat gray of a sky that had given up. She watched a maintenance worker scraping ice off the ambulance bay entrance with a push broom, methodical, unhurried, doing his work without any interest in whether anyone noticed. She understood that man completely. Inside, the department smelled exactly as it always did. She hung her coat in the staff room, pulled her hair back, clipped her ID badge to the chest pocket of her scrubs, and walked out to the morning handoff. The charge nurse at day shift was Paulette Gervais. She was a broad woman in her mid-50s with the energy of someone who had made peace with every inconvenience except incompetence. And she moved through the department like a slow-moving front, steady and inevitable. She had been charge nurse at Riverview for 19 years. She did not particularly like Nadia. She had said so, once not unkindly, with the directness of a woman who found diplomatic phrasing to be an inefficient use of oxygen. "You make people uncomfortable," Gervais had told her, 2 weeks into Nadia's tenure. "You're too quiet. People here think quiet means you're either slow or you're judging them." Nadia had not argued. She had said, "Understood," and gone back to her charting, and Gervais had given her a long measuring look, and then walked away without another word. That had been 4 months ago. The opinion hadn't changed much. Dr. Sterling Obi was the attending on days. He was 34, freshly credentialed, and wore his confidence the way some people wore new shoes, visibly, slightly stiffly, conscious of every step. He was not a bad doctor. He was a man who had been told his whole life that he was brilliant and had interpreted this to mean that he did not need to listen carefully to people who did not yet know it. He liked Riverview because the nurses here were largely deferential. He had assessed Nadia in her first week, decided she was slow processing and probably anxious, and had adjusted his interactions with her accordingly, speaking more loudly and with exaggerated simplicity when he addressed her, as though she were a student or a tourist. Nadia charted. She kept her mouth shut. She watched. The man 3 beds over on a Tuesday morning was 61, arrived by walk-in, complaining of chest tightness and mild nausea. His name was Gilbert Poulin. He was barrel-chested and soft-spoken and smelled faintly of machine oil. His wife had dropped him off and gone to park the car. The intake nurse, a chatty young man named Edouard, who had been on the floor for 8 months, had triaged him as non-urgent. Indigestion, probably. Acid reflux. The flu was going around. Nadia was passing with a tray of supplies when she paused. She did not know exactly what made her stop. Something in the way his hand rested against his sternum. The specific quality of his stillness, which was not the stillness of a man resting, but the stillness of a man concentrating very hard on something internal. She set the tray down. She pulled the curtain. "Mr. Poulin, can I ask you something?" He looked up. His eyes were focused, but there was something glassy at the margins. "Go ahead. Is the discomfort moving into your jaw, your left arm?" A pause. Little bit. I thought it was just. The wife keeps telling me I don't stretch enough. Nadia had already pressed 2 fingers to his radial pulse. It was there but weak, with a subtle irregularity that made her jaw tighten. She reached over and hit the call button without looking at it. Edouard appeared in the doorway. "What's up?" 12 lead, now. And get Dr. Obi. Edouard blinked. "He's with the now, please." The tone was not loud. It was not aggressive. It simply did not contain any room for discussion. And Edouard, perhaps on some instinctive frequency below conscious thought, heard that and moved. The ECG came back with a STEMI pattern that was unmistakable. Gilbert Poulain was taken to the cath lab 40 minutes later. The cardiologist who reviewed the chart afterward told Gervais that had he waited another 90 minutes, he would have been a very different kind of case. Gervais told Nadia this at the end of shift, leaning against the doorframe of the break room, arms folded. Nadia poured herself a coffee and said, "Good." Gervais watched her for a moment. "Edouard said you caught it on presentation. Before the ECG, the ECG confirmed it. That's not what I asked." Nadia sipped her coffee. It was terrible coffee. It was always terrible coffee. He had the presentation. Someone should have caught it at triage. "Don't," Gervais said, and her voice was not unkind. "Don't make this about a protocol gap. You caught something Edouard missed. I'm acknowledging it." "Okay," Nadia said. Gervais shook her head slightly and left. It went like that for months. Small things. The presentation that looked like one thing and was another. The abnormal sound in a set of breath, sounds that everyone else had written off as artifact. The patient in Bay 7 who said his pain was a 4 and whose body said otherwise, whose body Nadia read the way she had once read terrain. She never announced these things. She simply acted on them, charted them correctly, and moved on. And in the exact way that competence without performance reads as indifference, the department largely resented her for it. Dr. Obi had a phrase for her. He used it in the hallway, not quite loud enough to address her directly, but not quite quiet enough to be private. "Glacial Roussel," he said to his residents, with a smirk that he had calibrated to seem collegial. "You'll see her eventually make a decision. Mark the date." The residents laughed. They were learning what the culture rewarded. There was a nurse, Tanya Birch, who had been at Riverview for 6 years and ran the informal social architecture of the night shift with the precision and total authority of someone who had never questioned her own judgment. Tanya was good at her job in the ways that were visible. She was fast. She was loud in a way people mistook for confidence. She debriefed cases in the break room with a storyteller's flair and a comedian's timing, and everyone loved her for it. She had decided in Nadia's 3rd week that Nadia was either hiding something or broken, and had been quietly, cheerfully conducting an investigation into which one it was ever since. "Where did you even work before this?" Tanya asked one evening, leaning against the medication cart while Nadia prepped a line. "The chart says a clinic up north." "Timmins area?" "For a while," Nadia said. "And before that?" Nadia taped the line. "Varied." "Varied," Tanya repeated with a kind of delighted disbelief. "You're like a locked room, you know that? Most people, you ask them about their background, they tell you about their background. You give me word puzzles." Nadia handed her the empty packaging to dispose of. "I just prefer to focus on what's in front of me." Tanya laughed, though there was an edge in it. "See, that sounds like something people say when they've got something to hide." Nadia met her eyes. "Or something people say when they find the past less interesting than the present." Tanya's smile stayed in place, but tightened slightly at the corners. She pushed off the cart and walked away, and after that she was less cheerfully curious and more plainly watchful. The disciplinary meeting came on a Thursday in late March. The file was thin but purposeful. 3 incidents formally recorded. The first, Nadia had, during a chaotic overnight, administered a dose of adenosine to a patient in rapid SVT without waiting for Dr. Obi's verbal confirmation because Dr. Obi had been unavailable and the patient had been deteriorating, and Nadia had known with a clarity she could not entirely explain to a review board exactly what was happening and exactly what to do. The patient had converted. Obi had arrived 12 minutes later and had filed the incident report that evening. The second, Nadia had, in Tanya's assessment, displayed a pattern of undermining team communication by acting unilaterally on clinical assessments without discussing them with the attending first. The third was vague, which meant it was personal. It read, persistent pattern of non-collaborative behavior inconsistent with the departmental culture. Gervais was in the room. She sat slightly apart from Obi and the department administrator, a trim, methodical man named Whitaker, who wore the expression of a man who managed liability rather than people. Gervais had her hands folded on the table and her face carefully neutral. Obi sat forward. He had prepared for this. He had the particular energy of a man who had confused being right with being correct. The issue isn't whether the clinical outcomes were good, he said. The issue is process. You acted outside your scope, Roussel. Twice. That's not initiative, it's insubordination. We have structures here for a reason. Nadia sat with her hands flat on the table and looked at the middle distance. Do you have anything to say for yourself? Whitaker asked. Nadia considered. She thought about the forms she could use. She thought about the careful, translucent language of institutional self-defense. She thought about 2 years of a box she had built around herself, 4 tight walls and a lid pressed firmly shut. The patients were in danger, she said. I had the skill to address that danger. I addressed it. I'd do it the same way again. Obi made a small sound of disbelief. That is exactly the attitude. We're going to recommend a formal performance review, Whitaker said, overriding him. In the interim, Roussel, you'll be moved to restricted duties. You'll operate under direct supervision only. Any independent clinical decision-making is suspended pending the outcome of the review. We'll reconvene in 3 weeks. Nadia nodded. She reached for her badge by habit, the reflex of a woman who had been dismissed from enough rooms to know what the end of a meeting felt like. Then the building moved, not violently, not a structural shift, a rhythmic concussive pressure, the deep thrumming vibration of something large and mechanical descending. The fluorescent strip above Whitaker's head flickered. The water in his plastic cup shivered in precise concentric rings. Nadia went very still. She knew that sound the way she knew her own heartbeat. She had heard it in Kandahar. She had heard it outside the wire in Kabul. She had heard it at the hospital in Bagram at 3 in the morning when the Kasvak birds came in low and fast with their cargo of broken people, and she had 30 seconds to be ready before the doors opened. That was a cyclone. Canadian Forces SAR, the big variant, heavy rotors, and it was landing on the roof. The emergency line on Whitaker's desk rang. He answered it with the mild irritation of a man perpetually interrupted. His face changed. He put the phone down slowly. There's been an incident at the training facility off the escarpment. Military SAR exercise. Rope access accident, multiple injured, a collapse. He looked up. They're diverting here. Closest trauma-capable facility. Gervais was already moving. Obi straightened his coat and followed. The meeting, the performance review, the suspended clinical authority, all of it lifted away like paper in wind. Nadia walked out behind them, and no one told her to stay. The elevator from the rooftop access opened, and the hallway changed completely. They came in hard, the way people who have been moving in controlled emergencies move, which is nothing like the way civilians move in a crisis. There were 4 of them in dark olive flight suits and harnesses, still carrying gear, moving with the synchronized compressed efficiency of people who do not have extra time to spend on anything. They had a stretcher between 2 of them. A 5th person, a woman, was walking under her own power, but had her arm immobilized at a sharp, wrong angle and was not making any sound about it, which meant she was either in shock or had simply made a decision that sound was not useful right now. On the stretcher was a man in his late 20s. His suit was partially shredded on the left side. A rope had failed, or something had failed, and he had fallen, and the rock face had done what rock faces do. His left leg was a problem. His chest was a problem. His face was a color that did not belong on a living person. The one walking point barked the handoff in clean, rapid fragments. She was compact and quick-eyed, and she spoke the way people speak when they have given this kind of report many times and know that every unnecessary syllable is wasted. Mechanism, vitals, interventions en route, estimated blood loss, time of injury. Dr. Obi was standing at the entrance to Trauma Bay 1. He heard the report and moved toward the stretcher. "Okay, let's get him in and get a look. I'll need." His pelvis is unstable. The point person's voice was not raised. It was not rude. It was simply stating a load-bearing fact in the same tone you would use to tell someone a bridge had been closed. "We've got a pelvic binder on. Do not remove it until you have a trauma surgeon in the room." Obi's hands paused. "I'm the attending physician here. I think I know how to." "With respect, doctor, the last time someone removed a pelvic binder before surgical backup was available, we lost the patient before the OR was prepped." She was not threatening him. She was telling him a fact. "Do you have a trauma surgeon available?" Obi opened his mouth. "Burkholz is in the building," Gervais said from behind him, already reaching for the internal phone. "I'll pull him down." "Good. Thank you." The point person's eyes swept the room, assessing. They moved past Obi, past Tanya, who was standing with a tray of supplies, and the wide eyes of someone watching an entirely different species operate. And then they stopped. They stopped on Nadia. The point person's face did something complicated, a rapid recalibration, like a map that suddenly shows a landmark the navigator wasn't expecting. "Roussel," she said. It wasn't a greeting exactly. It was more the way you would say a word you hadn't said in a long time and were checking to make sure you still remembered how it sounded. Nadia looked at her, at the face, at the set of the jaw and the eyes and the particular way she stood with her weight on her back foot even when she was standing still, ready to move in any direction. "Sauvage," Nadia said. "Corporal Jade Sauvage, 427, Special Operations Aviation Squadron out of Petawawa," looked at her former flight medic for a long moment with an expression that Nadia suspected other people would not have known how to read. Nadia read it the way she read everything, carefully, without hurry. "What the hell are you doing in Hamilton?" Sauvage said. "Working," Nadia said. Sauvage let out a sound that was almost a laugh. Then her eyes moved to the patient, and the almost law was gone, and she was back inside the operation. "He's our primary. The leg is the secondary issue. His breathing has been degrading for the last 8 minutes. We think there's a tension component." Nadia was already moving to the bedside. Her hands went to his neck, to his trachea, feeling the drift. She put a hand on his chest and watched it rise. She listened. "He's deviating," she said. "Right side. Give me the kit. I'm sorry." Obi stepped forward. His voice had a new edge in it, a controlled frustration that people use when they are about to remind someone of their institutional position. "You are under restricted practice, Roussel. You need to step back and let me evaluate. The trachea is deviated 2 centimeters to the right." Nadia did not look up from the patient. "His breath sounds are absent on the left. He has jugular distension. Sterling." She did use his first name, not because it was intimate, but because she needed him to be present with her, not above her. "Look at his neck." A pause. Obi looked. The silence in that pause was a particular kind of silence. The silence of a man who has been asking himself whether something is wrong and has just been shown the answer. "He needs a needle," Nadia said quietly. "Right now." Obi's hands moved toward the kit, then stopped. She could see the paralysis forming, the conflict between authority and certainty, between what the chart said she was permitted to do and what the patient's body was telling anyone with eyes that needed doing. Sauvage took 1 step forward. It wasn't threatening. It was simply a presence communicating the same thing her earlier words had communicated. The facts of the matter. Gervais, from across the room, said nothing. But she moved to the supply cart and laid a 14-gauge needle and a 10 cc syringe on the tray within arm's reach. She did it quietly, without comment, and then she stepped back. Nadia picked it up. She found the second intercostal space, mid-clavicular line, the way she had found it in the dark, in the field, in aircraft doing things. Aircraft should not have to do. Her hands did not shake. Her pulse did not climb. She had stood in burning buildings. She had worked on a man while under fire in the Panjshir Valley with nothing but what was in her vest and the knowledge that was in her hands. A trauma bay in Hamilton, Ontario, was by any measure easier. The needle went in. The hiss of escaping air was immediate, decisive, and the monitor that had been screaming irregular warnings began slowly to steady. The patient's color did not improve all at once, but it improved in increments, the blue receding from his lips like a tide going out. Sauvage exhaled through her nose. "Chest tube," Nadia said, holding out her hand. Gervais put it there. She worked. She did not narrate what she was doing. She did not explain herself. She simply did what she had been trained to do and what 7 years of operational medicine had made part of her body rather than her mind. Obi stood to the side. He picked up the secondary role with a visible effort, drawing labs, calling out vitals, working the room with a competence that was real. She had never doubted his baseline competence. It had just never been tested the right way before. He was better when he was not in charge of everything. People usually were. The trauma surgeon arrived 12 minutes later and took the handoff cleanly. The patient was alive and would remain so. Nadia stripped her gloves and moved to the sink. Behind her, she heard the room returning to itself. The elevated voices settling, the equipment being repositioned, the specific exhalation of people coming down from the high wire. Tanya was standing near the doorway. She was not saying anything. She was looking at Nadia's back with an expression that Nadia did not see, but that Gervais did. Sauvage came to stand beside Nadia at the sink. "Still carrying the shears in the waistband," Sauvage said. Nadia looked down. The matte black handle was just visible below the hem of her scrub top. She had forgotten. Old habit. "Apparently," she said. Sauvage was quiet for a moment. The water ran between them. "You're wasted here." "It's a job," Nadia said. "That's not what I mean." Nadia dried her hands. The paper towel caught and tore, the cheap perforations giving way too soon. I know what you mean. Do you remember? Kava, Sauvage said, and the way she said it told Nadia that this was not really a question, that it was the thing she had been building toward since the moment she'd recognized Nadia in this hallway. Nadia went still. Yes, he told me once. Before the second rotation, he said the best medics he'd ever worked with were the ones who couldn't turn it off, couldn't make themselves not see what was in front of them. Sauvage looked at the wall. He said that was also the thing that broke them. The room was quiet around them. He was usually right about things, Nadia said. He was almost always right about things. Sauvage agreed. Whitaker appeared in the doorway of the break room where they had drifted without Nadia quite noticing they had moved. He was holding his tablet. He looked at Nadia with the particular expression of a man who is about to recalibrate a position he has previously stated on the record. Roussel. He cleared his throat. Given the circumstances today and Dr. Burkholtz's preliminary assessment of the patient's status, we feel it would be appropriate to defer the performance review process. Nadia looked at him. That is to say, Whitaker continued, the restricted practice designation will be lifted pending a formal reassessment, which I think we can all agree, under these particular. Is the review cancelled or deferred? Nadia asked. Whitaker blinked. Cancelled, yes. Okay, Nadia said. She walked past him, back out into the corridor. The fluorescent lights buzzed their flat, indifferent note above her. The smell was still there, antiseptic over copper, the permanent, honest smell of the work. She clipped her badge back to her chest pocket. She picked up the chart at the nursing station for her next patient. Gervais came to stand beside her, not close, just adjacent. The way you stand beside someone when you're not trying to make a point but you are making one anyway. You could have said something, Gervais said quietly, at any point in the last 4 months. You could have said. Said what? Nadia pulled up the chart. Gervais paused. What you are, what you've done. Nadia considered this. She thought about the box, the 4 walls, the lid, the way it kept certain things at a manageable distance and certain other things from getting out and making a mess of a life she was still trying to understand how to live. It wouldn't have made any difference to the work, she said. Gervais was quiet for a moment. No, she said. I suppose it wouldn't have. She walked back to the charge desk. Tanya had disappeared somewhere, presumably to reconfigure something she had decided about the world. Dr. Obi was in Bay 2 with a resident, going over a case, in a voice that was slightly quieter than his usual register. Nadia read the next chart. The department moved around her, the way it always moved, loud, imperfect, necessary. She had stopped expecting it to be something other than what it was. That was its own kind of peace, not the peace she had imagined when she'd left, not the silence she'd been chasing since Kandahar, but something that was at least honest, which was she had come to understand, the best you could usually ask for. She picked up the chart and walked to Bay 5 to meet her next patient. Her shift wasn't close to over.